Okay, hello, I'm Nihaya Daoud. I'm a public health researcher in Ben-Gurion University of the Negev. I'm going to tell you about Corona and how it's challenged the healthcare system here in Israel. Actually, what we see that the coronavirus actually challenged the healthcare systems in all countries in the world. And we see that it also examined the preparedness of these healthcare systems regarding dealing with such a pandemic, worldwide pandemic. The other thing that we noticed regarding the corona is that it showed actually the gaps between different groups of society and the gaps in the abilities of these groups to deal with such a pandemic. And regarding the Palestinian Arab citizens of Israel, we see that this pandemic challenged very much the government and also the society in dealing with this pandemic. At the beginning of the coronavirus crisis in Israel, we noticed that the number of patients, of corona patients in the Arab society were very low. And this was a surprise for us because we thought that the Arab society is at risk for having more corona patients because the Arab society has more chronic illness and also lower socioeconomic status. And what we realized that there were a few patients because there were very few tests that were conducted in the Arab society. And we called the government to increase the numbers of tests in the Arab society. And we now see that there are much higher numbers of patients and we see that it is multiplying very quickly in the Arab society in a very, we are very worried about this. The other gap that we noticed in the Arab society regarding dealing with this virus is related to information. We noticed that the information in the Arabic language came very late by the Ministry of Health, and people were very anxious about knowing more about the virus and how to deal with it in their own language. So this gap of information and the time that it arrived make the society more anxious, and people now we feel that the people were less trusting of the information that came late. And we see that there is a kind of stigma that is going on now around being a patient of corona, which needs a lot of attention by us and also, of course, by the government. And the third gap that we actually identified regarding the corona, which is, related to the health policies and the healthcare system organization in Israel in general, which is related to the healthcare services, of course, and the healthcare services during emergency. We found that the emergency services in the in the Arab villages and towns is had been private for many years because of certain conditions, and these private companies for emergency were not trained to deal with corona and corona tests, and therefore we saw that the number of tests is very low. We started, to advocate for these gaps, talking with the government, with the Ministry of Health, and we see that things are changing, but it is not as we actually see that it should be. I have to highlight a very important thing here that, we see that the Arab professions, healthcare professionals in Israel means physicians and nurses and public health specialists are at the front now of dealing with the corona, especially those who are working at hospitals. And they actually are participating in the efforts of protecting the population, all population from corona. And I think that they need to be quiet about going back home to their homes in the villages and towns of the Arab society. Once they are working, once they are back from their work at the hospitals. And what we see is that the numbers of corona now that is multiplying and it is increasing very quickly in the Arab society will not give them this quiet feeling. So we think that the Arab population should be represented in the emergency committee, or the committee that is dealing with this emergency situation at the higher level. And there should be also more representatives from the health, public health specialists who need to be in this committee. Currently, there are not, and I think it's a mistake, and they should be included in this committee.
Dr. Nihaya, a question, please. Do you think that there are special concerns and challenges regarding the coming of the month of Ramadan?
Yes, I think the Ramadan is the time that many families gather around the break meal, which is around the 6-7 o'clock. And so it's a lot of gathering, it's a celebration, people meet around these meals, and they also do festivals and other celebrations. And I think this time of the year can be a very important, because if we are not cautious about it, I think the spread of corona will increase at much higher levels than we expect. So I think we need to bring to the attention of the society everywhere, and also to the government, that they should help the Arab society during this time to pass the month of Ramadan without the spread of the virus. I have to say that the Arab population, because it is a lower socioeconomic status and many workers live in the Arab society, this means that, and they already now 1 month at home, this means that many of them are not getting salaries. And to keep them another month at home during the Ramadan, it will be very difficult for them to stay at home and not go to work. So I think that there should be also an economic plan for the Arab society to help the families pass the month of Ramadan without serious damage to the family economic and finances. And this has to be, coming from the government, because the society is very weak, and I don't think economically, and I don't think that they can actually do this as a society alone. What we did as professionals, we try to provide information in Arabic about the corona and about being infected and how to protect yourself from this, but we don't have the economic power or the ability to actually cover the government in this case, and the government has to do this plan for the Arab society in Israel.
Thank you very much.
Thank you.